So we were talking about that what is the effect of adrenergic system on the heart. As we know, heart should be stimulated, so heart should have stimulatory receptors, right? Either alpha 1 or beta 1, but as you know, all the tissue to be stimulated have alpha 1 except heart, juxtaglomerular apparatus and adipose cells. So heart is one of the exception, right? So it has beta 1 adrenergic receptors dominantly, right? So beta 1 adrenergic receptors are present on the SA node, AV node and on the Purkinje system. Moreover, they are present on the atrial contractile myocardium and ventricular contractile myocardium. Now, what is the effect of this on the heart? When SA node is stimulated, what is the normal function of SA node? SA node is responsible for cardiac automaticity. How do you define automaticity? Automaticity is a property of a tissue to produce depolarizations spontaneously. Because SA node produces depolarization spontaneously, it is normally the pacemaker of the heart when it is stimulated by the adrenergic norepinephrine or epinephrine acting on the beta 1 receptor, pacemaker activity will increase, right? So heart rate will increase. So there is increased heart rate due to action here. An increased heart rate is called positive chronotropic action. Chronotropic action. Chronotropy mean, here chronotropy mean related with the normal automaticity. Normal automaticity. So when normal automaticity of the heart is increased, we say there is positive chronotropy. Number one. Number two, there is also stimulation of, what is this? AV node. When AV node is stimulated, the conduction through AV node becomes fast. The impulses are conducted fastly from the atria to the ventricle. So we can say under the influence of adrenergic drive, adrenergic stimulation, AV node's conduction velocity increases. And when conduction velocity in AV node and this conduction system increases, we say there is positive, yes please, there is positive dromotropic action. This is called, yes, when conduction through AV node is increased, we say there is positive dromotropic action of the drug or action of the neurotransmitter or action of the hormone, right? How do you remember that it should be called dromotropic? I always think that AV node is like a small drum between the atria and ventricle. So whenever drug stimulates this drum, there is positive dromotropic action. Is that right? No problem into this? Then we can come to the action on the myocardium, right? But before we really go for that, when there is positive chronotropic action plus there is positive dromotropic action, both of these actions lead to increased heart rate. So this component is achieved by increasing by positive, yes, chronotropy and by positive dromotropy. Is that right? Action on SA node, action on AV nodal drum. Now we come to action on the myocardium which contracts, right? Atrial myocardium and ventricular myocardium. This myocardium has also beta 1 receptors and this is also stimulated. And when they are stimulated, their action is contractility. And when they will, especially when ventricular myocardium will contract strongly, when ventricular myocardium will contract strongly, of course that will produce more stroke volume. Is it right? When it will contract strongly. So increased contractility is called, yes, increased contractility is called positive inotropy. Inotropic action, positive inotropic action or positive inotropy. And this factor lead to increased stroke volume. So we can say when epinephrine or when catecholamines or epinephrine and norepinephrine act on the heart, they increase heart rate, increase the conduction through the conduction system, especially AV node, and they increase the contractility, right? And when heart rate is increased and stroke volume is increased due to increased contractility, is increased cardiac output. Is there any question here? There is no question. And of course, whenever cardiac output is increased, systolic blood pressure goes up. You know that or not? We'll discuss blood pressure changes in detail when I will teach you the drugs, right? Drugs mean catecholamines, not other drugs. So we were talking about the effect of sympathetic nervous system on cardiovascular system. We have already discussed the effect on heart, right? And now we'll talk about the effect of sympathetic nervous system on the vascular system, right? So let's suppose this is your general circulation, right? From this general circulation, the blood supply is going to, let's suppose, skin. Here is your GIT, right? Then blood supply is also going to the kidney, right? And of course, your beloved skeletal muscle, which is going to help you to fight with the stressful circumstances. Blood supply is going there. And blood supply is of course going to, yes, central nervous system. So we can say that blood vessels, this is blood vessel going to skin. So cutaneous blood flow. This is mesenteric blood flow. This is your renal blood flow. And this is blood flow to skeletal muscle. Is that right? And of course, here is the blood flow to central nervous system. And here is blood flow to heart, coronary system. Now we have to see what happens to all these vascular beds under sympathetic activation, right? Again, as we discussed, that sympathetic nervous system is adjusting the tissues and organ in such a way that body should be more appropriately prepared to fight or flight the stress, right? Now under stressful circumstances, as that horrible dog is after you, right, we have to change the blood flow in different tissues. What do you think? Blood flow to the skin should be increased or decreased? Pardon, it is decreased or increased? People who believe blood flow to the skin should be decreased, they should raise their hand. Okay, people who believe blood flow to the skin should be increased, they should raise their hand. Okay, so you think you are going to blush there for the dog? Look, blood flow to the skin should be decreased, because if blood flow to the skin is increased, you blush there and dog is not going to take it. And another thing, if blood flow under the stress increase to the skin and if dog really bite, there will be more bleeding. So under very stressful circumstances, blood flow to the skin decreases. People don't become red, people become pale under fear. Is that right or not? So blood flow to the skin should be decreasing, and there are advantages. When cutaneous blood flow decreases, the blood which is saved can be diverted to the muscles. Secondly, reduced blood flow to the skin is good, so that if some damage to the skin occur, there should be less bleeding, right? Of course, under some circumstances, blood flow to the cheeks and some areas increases. Those circumstances are really not. That is not that dog is after you. That is some sort of romantic stress, you know. When you blush, isn't it? There was a time women used to blush and skin will become red, right? That is for different thing. I think more evolutionary, that is telling to the man, we have good hemoglobin, we can have a baby and everything, right? I don't know what, but anyway, women blush, it makes them more beautiful, more appealing. Is that right? But these days, if they don't blush, no problem, they blush on. Isn't it? It works still. Am I right? So blushing is not really that life-threatening stress, right? That is some emotional situation for which nature has provided different neuronal connections so that you can appropriately blush, right? But under real stress, blood flow to the skin goes less. And when don't actually really blushing is when you are embarrassed, sweetly embarrassed, right? But this is stressful circumstances. Dog is after you, or some examiner is asking you very tough questions and planning to throw you out, and you feel like this. You don't blush then. Then you pale, isn't it? So blood vessels to skin should constrict or dilate. Constrict. So smooth muscle of these blood vessels, smooth muscle around these blood vessels should be stimulated or inhibited. So which receptor should be there? Alpha 1. So cutaneous vessels have alpha 1 adrenergic receptors, right? Then already we have discussed blood flow to the GIT. That should be increased or decreased? Yeah? That should be decreased. That is not the time to increase the blood flow and to the GIT. We should save the blood from the GIT and divert to the muscles. So smooth muscles to GIT vasculature. Smooth muscle in the mesenteric arteries should constrict or relax? It should constrict. You know, you want more blood flow or less? If you want less, it should vasoconstrict or vasodilate. It should vasoconstrict, so smooth muscle should be stimulated or inhibited? Stimulated. Which receptors should be there? Alpha 1, right? Adrenergic receptor. What about renal blood flow? You should increase blood flow to kidney or decrease blood flow to kidney, right? Decrease blood flow to the kidney, as I told you previously. You can make urine later, right? In more appropriate when you are relaxed. But right now you constrict the renal vessels so that blood can be diverted to the muscles. Is that right? So for here there should be, these smooth muscles should be again stimulated or inhibited. So which receptor should be there? Alpha 1 adrenergic receptor. Remember, some people under stress pass out urine. That is not kidney function. That is an autonomic dysfunction precipitated under stress to the urinary bladder. Normally, urinary bladder under stress should hold the urine. It doesn't help to pass out the urine under stress. Is that right? That's a dysfunction. Anyway, come back. What about skeletal muscles blood flow? You want more blood flow to skeletal muscles or less? More. So blood vessels to skeletal muscles should constrict or dilate. So you need to stimulate the smooth muscles or relax. So you should have stimulated receptor inhibitory. Which one should be there? Beta 2 adrenergic receptors. So this is the action of what? Adrenergic system, sympathetic nervous system on your cardiovascular system. And of course we should not forget blood flow to the brain and heart itself. Cerebral blood flow should increase or decrease when you are under stress? It should increase so that blood vessels dilate and produce severe headache. Do you think it's good? When cerebral vessels dilate, you precipitate headache. Did you know that or not? All the drugs which dilate the vessels, they produce headache. Right? Why? Let me explain, and then I will say, suppose this is your central nervous system here, happily there. These are the blood vessels going to your central nervous system. Right? And of course they are passing through these foramina. These are the foramina, isn't it? And in these foramina, right, you must be knowing that dura mater, there is dura mater lining, dural sleeve come here. Do you know that? The blood vessels which are entering or leaving the central nervous system. In the dural sleeve, in the dura mater here, there are very high concentration of pain receptors. What are receptors here? Pain receptors. So whenever these blood vessels dilate too much, they hammer on they dilate with every pulse. They dilate and hammer on the pain receptors on dural sleeve, and you feel throbbing headache. Headache with every pulse. Isn't it? So dilating vessels too much to cerebral system is really not a good thing under stress, because you will have headache. So what should happen to cerebral blood vessels? And if they constrict, you will simply with ischemia fall down. You know what I'm trying to tell you? Blood flow to central nervous system is so important to the nature, it is not left at the mercy of autonomic fluctuation. This you should remember. Blood flow to the central nervous system is so important, it is auto-regulated by the central nervous system. It is not left at the mercy of autonomic fluctuations. Am I clear? So, cerebral blood vessels do not have any significant concentration of adrenergic receptors. Cerebral blood vessels do not have any significant concentration of what? Adrenergic receptors. So sympathetic fluctuations don't control cerebral blood flow. Cerebral blood flow is auto-regulated by the metabolites produced by the brain. When central nervous system is working more, it produces more metabolite which dilate the cerebral vessels. And some part of central nervous system which is not working much, that will produce less metabolites and there will be less dilation of the cerebral vessels. So I hope you will remember it. Thank you for remembering it. What about coronary blood flow? That should increase during the stressful circumstances or decrease? That should increase. So which receptor should be there? Alpha 1 or beta 2? I'm talking about not the adrenergic receptors on a heart. I'm talking about the adrenergic receptors on coronary blood vessels. There should be alpha 1 or beta 2. Either there should be none or both should be equal in number. You know why? Coronary blood flow is again so important, it should not be left at the mercy of autonomic fluctuation. Coronary vessel diameter is mainly regulated by the auto-regulation by the myocardial products. When myocardium needs more blood flow, it produces the metabolites which dilate the coronary vessels in their branches, like cerebral system. Coronary blood vessels are not left at the mercy of autonomic fluctuations, thank God. Isn't it? Otherwise you see a girl, you get tachycardia, sympathetic nervous system is up, and then you say, oh, I get myocardial infarction. By the age of 30, maybe we get 40 myocardial infarctions. That is not good. So the blood vessels, the coronary blood vessels to the heart are not left at the mercy of autonomic fluctuation. And the most funny thing, these blood vessels, coronary blood vessels, do have adrenergic receptor, but the concentration of adrenergic receptors, alpha 1 adrenergic receptors and beta 2 adrenergic receptors are same. So whenever epinephrine goes there, alpha 1 receptors try to constrict and beta 2 receptor try to dilate, so there is no significant effect. But maybe in Prinzmetal angina, you know Prinzmetal angina, vasospastic disease of the coronary vessel, probably the multiple mechanism. One of the mechanism is that beta 2 receptors may be less and alpha 1 receptors will be inherited more. We will not talk about that here. You will learn that in pathology. What I really wanted to tell you, that cerebral circulation, cerebral vasculature and coronary vasculature, again it's worth repeating, is not left at the mercy of autonomic fluctuations by the nature. These two vasculature have either very few adrenergic receptors, and if they do have adrenergic receptors, then stimulatory alpha 1 adrenergic receptors and inhibitory beta 2 adrenergic receptors are in same concentration. Am I clear? Any problem here? No. Now let's move forward and learn more about the action of adrenergic drugs or adrenergic system or sympathetic nervous system on other tissues. Up to now, what we have learned, you are under stress, right? So your hair stand up, your pupil dilate, right? Your mouth is dry, your heart, your bronchial, yes, these are dilated, and your heart is stimulated. Am I right? It is stimulated, increase heart rate, increase, and vascular blood flow is also altered. Is that right? And now we should come to some other tissues. And about GIT we have also discussed what will be changes in the GIT. Now we'll talk about What you want to discuss? We can talk about metabolic changes in the body, or you want to talk about urogenital changes in the body under stress. Yeah, it's your choice. Okay, I leave choice to Dr. Sergio Mauri. You want to discuss what first?
Metabolic changes.
You want metabolic changes. He shy away, from the changes in the genital system. I don't know why, but we'll come to that also. Okay, he want to know that what are the metabolic changes in the body when sympathetic nervous system is really working well, right? Okay, let's talk about few changes. Here is your circulatory system, right? Here is your liver, one of the very important metabolic organ, and of course there must be, what is this? Fat cell, adipocyte, right? And there must be muscle also, skeletal muscle. Right. First of all, under stress, one of the very important function of the liver is, take the glucose and convert the glucose into, yes, glycogen. Whenever you are in well-fed state, you have eaten a lot, glucose is going to your liver, and liver cells are taking up the glucose and making the glycogen and storing the glucose. Do you think under stress you need to store glucose as glycogen? Do you think under stress you must do glycogenesis? No. Glycogenesis should stop. Rather, glycogen should break down into glucose, and glucose should come to the blood. Am I right? So glycogenesis should be inhibited. So there should be stimulatory receptor, inhibitory receptors. So there are inhibitory receptors, and which receptors should be there? Beta 2 adrenergic receptors. So liver cells have beta 2 adrenergic receptors which give inhibitory signals to stop the glycogenesis, and that releases automatically the pathway for the breakdown of glycogen, and there is glycogenolysis going on and glycogen breakdown, and glucose is coming to the blood. So under stress, liver is releasing what? Glucose to the blood, so that glucose supply to the muscles and to the brain should be more under stress. This is one thing. Secondly, best form in which energy is stored in the body is triglycerides. One glycerol with 3 fatty acids in the adipocyte. Am I right? In the adipocyte there are triglycerides. Now, do you think there is a muscle here, right, which will break down the triglyceride? Not muscle, of course. There is an enzyme here. This is triglyceride, and there is an enzyme here, and this enzyme, when it is activated, this enzyme will break down the triglyceride and release free fatty acids and glycerol, isn't it? Now, and of course, these free fatty acids are a very good source of energy directly, plus this free fatty acid can go into liver, and in the liver from fatty acid we can make glucose. This pathway is called gluconeogenesis, formation of glucose from new sources, like formation of glucose from amino acids, the formation of glucose from fatty acids, right? So it means the appropriate metabolic change in the body under stress should be that there should be lipolysis, there should be breakdown of the lipid, there should be lipolysis and increase free fatty acid level in the blood. With that, there should be, yes please, gluconeogenesis, so that fatty acids convert into glucose. Am I really clear? So, do you think this breakdown of lipids and this lipase, this should be stimulated or inhibited? Stimulated. So which receptor should be there? Stimulatory or inhibitory? Stimulatory receptors, and stimulatory receptor here is, yes, it cannot be alpha 1 because this is an exception. So it is beta 1. Actually it is really not beta 1. It is modified beta 1, and modified beta 1 these days is called beta 3 adrenergic receptor. Am I clear? No problem in understanding this, right? So free fatty acids are coming and going there. So liver has an organ releasing the glucose. It is releasing the glucose by breakdown of glycogen, right, which is called glycogenolysis, and it is also releasing glucose by gluconeogenesis, right? Trying to maintain. Look at the dog, how much changes he has induced in your body, isn't it? Now, so your blood glucose level will go up, and blood free fatty acid level is also going up. And now let's go to the skeletal muscle. In the skeletal muscle, skeletal muscle also store glucose as glycogen. Do they have glycogen or not? Okay, that's very good. Thank you for knowing it, that skeletal muscle also take glucose to glycogen. Do you think this process should be stimulated or inhibited? Inhibited, because skeletal muscle are under more action, and if skeletal muscles are under more action, they need glucose. They don't need to store glucose as glycogen, they need to break the glycogen back to glucose. So this process, that glucose should be converted into glycogen, should be stimulated or inhibited? Inhibited. So which receptors should be here? Beta 2, very good. Beta 2 adrenergic receptors are present on the skeletal muscle cells, and that inhibits the glycogen formation and activate the glycogen breakdown, so that within the skeletal muscle more glucose is available as energy for contracting and running away from the dog, right? And of course, another thing, that when skeletal muscles are having a lot of action, depolarization, repolarization, there is electrical activity followed by mechanical activity. When you are having a lot of contractions and running away from the dog, skeletal muscles, cell bodies are undergoing depolar action potentials followed by contractions. So when there are action potentials going on, let's suppose this is one skeletal muscle cell, repeatedly action potentials going on. During every action potential, sodium goes, yes, and sodium in flux produces depolarization, right? There's sodium in flux, and there is loss of, during depolarization sodium goes in, and during repolarization potassium comes out. So actually, when muscles are contracting too much, what is really happening? During every depolarization, more sodium is going into skeletal muscle, and every repolarization which follows depolarization, potassium loss is there. And this imbalance is corrected by, what is this? Sodium potassium ATPases, which will, whatever sodium has gone in, they will throw that sodium out, and whatever potassium has escaped out, that will go in. Is that right? Now you tell me something. That this process, that potassium is being lost during contractions, potassium is being lost, it should be stopped or it should be accelerated? You want to lose more potassium? We should bring this potassium back. Should we bring back or not? If you are running and sodium is going in and potassium is getting lost, this potassium should be brought back. Is it important or not? If too much potassium is lost, cell membranes become so electronegative that there is hyperpolarization and muscle cannot be stimulated. Do you think that should be happen? So somehow we should not allow the cell to lose its reserve of what? Potassium. So what really happens, that again there are beta 2 receptors here, right? These beta 2 receptors give signals, intracellular multiple signals, which eventually lead to phosphorylation of sodium potassium. They bring the changes into sodium potassium ATPase, and it work more. This is a very important point. When you are gaining sodium or losing potassium, balance is corrected by whom? Who correct the balance? Sodium potassium ATPase. So sodium potassium ATPases should be stimulated. And if you need to stimulate them, what will happen? They will throw the sodium out and they will take the potassium in. So what really happens in sympathetic overflow, sodium potassium ATPases in the skeletal muscle cells are activated, and skeletal muscles start taking up the potassium from the blood. Is that right? This is another metabolic change. You will learn the significance of this phenomenon later on, that in some diseases we give beta 2 stimulant drug. The diseases in which muscles lose excessive potassium, right? Now in this case, actually receptors are beta 2, not stimulatory but inhibitory. Receptors are beta 2. So beta 2 receptors are stimulated, right? And they give intracellular signals. Here this is an exceptional situation. They give intracellular signals which stimulate sodium potassium ATPases. So in rapidly contracting muscles and muscles undergoing rapid action potentials, right, keep on correcting their ionic balance. I think you could not understand it clearly.
Yeah, because if it's an inhibitor.
There should be inhibitors.
Yeah, so what?
I understand what's going wrong with your mind. Actually, listen, life is, you can live a good life with general principles, but you'll come across situations where there are exceptions. There are exceptions. This is exception. Actually, your mind is working so that if we have to activate sodium potassium ATPase, then we should have stimulatory receptor. Right? Here nature has played a trick. It is using the same receptor to breaking down the glucose from glycogen. Same receptor gives signals and alter that. Right? So actually, here receptor is not stimulatory. It is still inhibitory. But intracellular signals are going to stimulate the sodium potassium ATPase. This is one exception. There are other exceptions also, but I don't want to talk about them right now. Yes.
In the case of glucose going to glycogen, we know that we need to inhibit that, so that's beta 2 receptors. But glycolysis, that's breaking down.
Glycogenolysis.
Okay.
Yeah.
In that case, we also use
Look,
beta 2 receptors.
listen. Generally, what happens? The enzymes which are converting glucose into glycogen, whenever those enzymes are inhibited, then enzymes breaking down the glycogen are released from inhibitory action and they are activated. Because until glucose supply is good and glycogen synthetases are working more, then glycogen breaking enzymes are automatically inhibited. But whenever you inhibit the process of glucose to glycogen, when these enzymic pathways inhibited towards this side, these enzymes which are bringing glycogen to glucose, they are released, right?
So it doesn't need a receptor.
Yeah, it doesn't. It does not. Now we move forward. In a nutshell, what we can say, then in the skeletal muscle, not only blood flow is increasing to skeletal muscle, rather skeletal muscle start breaking down glycogen to glucose, plus skeletal muscle is also taking up the potassium from the blood. Is that right? When you are exercising too much. Now we move forward. As a general, what are the metabolic changes in the body under adrenergic stress? Metabolic changes are that glucose level in the blood will go up, free fatty acid level in the blood will go up, potassium level will eventually go down. Is that right? And glycogen in the muscle will also break down into glucose. Am I clear? There's any problem? There's no. Now we move forward. Okay, I would love to mention one more thing. You know, in the muscle, skeletal muscle, there are intrafusal fibers and extrafusal fibers. Extrafusal fibers are the fibers which contract, and intrafusal fibers are like muscle spindles. You know that? These muscle spindles are responsible to maintain the balance and sensitivity of this contractile apparatus. These are also having beta 2 receptors, and that inhibit the function of muscle spindles. Listen carefully. If I'm keeping my hand steady, then there's a muscle tone on agonist and antagonist, and that tone is equal on agonist. Flexors and extensors are equal tone, and I'm keeping my hand steady. The tone is maintained well with the help of muscle spindles. Muscle spindle adjusts the sensitivity of the contraction of muscles. Now, when adrenergic activity becomes too much and beta 2 receptors are stimulated on muscle spindles become inhibited and dysfunctional. When they become dysfunctional, you cannot maintain flexor and extensor tone equal. So sometimes flexor extensor tone become more, sometimes flexor tone become more, then you correct it by, so they start undergoing tremors. So that is why under sympathetic overflow or under fear or under anger, you have tremors, or even when you are having some drugs which are beta-2 stimulant like salbutamol, terbutaline, albuterol, these drugs also produce tremors. Am I really clear? Right? Any question up to this? Now we have discussed this, and if Dr. Sergio Mauri allows us, we can talk about the sympathetic action on urogenital system. Yes, doctor. Should we discuss? Yes. Okay, thank you for granting permission. Right. So, you want me to discuss male genital system first or female? No. I leave the choice with Dr. Sergio Mauri. That's action of autonomic nervous system.
Ladies first.
Ladies first always. I never knew he has such a good taste. Okay, so we should make a uterus there, because you cannot imagine a woman without uterus, isn't it? Okay, I will use the different color. Right, so here we have uterus of a lady and of course vagina, and now we have to see what is the action of autonomic nervous system on this part of the urogenital system. First of all, you must know that ladies have smooth muscles here in the myometrium. You know myometrium? Right? Now, first of all, about the myometrial smooth muscle. Myometrial smooth muscle should contract, or they should have stimulatory receptors or inhibitory receptor when they have sympathetic overflow. When female has a sympathetic overflow, and remember during orgasm there is an intense sympathetic overflow. Female should have in the myometrium stimulatory receptors or inhibitory receptor. No one wants to talk about it. It is still taboo. Yeah, stimulatory, right? Why female should have stimulatory receptors on myometrium? Because during orgasm, uterus should have little contraction to take up the semen. Is that right? To facilitate upward movement of the sperms, right? Now, according to your theory, there should be stimulatory receptors, and which stimulatory receptors should be there, my friend? Okay, you want to have alpha 1 receptors over there, and if alpha 1 adrenergic receptors are present over there, your thinking is that whenever female will have orgasm, uterus will contract maybe violently and take up some material up. So this makes some sense. But there is one problem. Eventually the result is female will become pregnant sooner or later. And once she becomes pregnant, and pregnant women, they become angry very soon. One of the very important reason is men are unfortunately not really, when female pregnancy advances and they start looking around, right? So she is angry. And if a pregnant woman undergoes anger burst and uterus contract, this beautiful baby will come out and threaten to come out before time. Do you think it's a good news? Right? It's a very bad news. Do you think if a uterus contracts, every time a pregnant female undergoes stress and uterus contracts, right, is that good news? No. Female is a wonderful organism. She is responsible to maintain our species, right? Baby should be upside down. I think you don't know about exceptions. Right? Okay. So, yeah, you are worried about baby, I'm worried about women. Right? So we are talking about that you want to have a uterus which has a lot of alpha 1 receptors on myometrium, and whenever she gets angry, uterus contract and baby's products of conception are threatened to come out. Do you think it's a good situation? No. So which receptors should be there? Inhibitory, so that whenever women get angry, sympathetic overflow occurs. uterus at least relax and her baby should not suffer. So you think now another theory has come from another person, and the theory is this, that we should have inhibitory receptor, and inhibitory receptor will be beta 2 adrenergic receptor, right? Now let me tell you the beauty of the nature, right? The beauty of the nature is, as you know, female are very clever. What they do, they express those receptors which they really need. Female who is not pregnant, actually in the nucleus of this myometrial cell, there are gene for alpha receptor as well as gene for beta 2 receptor. When female is not pregnant and estrogen and progesterone changes are cyclical, right, during her monthly cycles, then alpha 1 receptors are expressing, and she is making more alpha 1 receptors and less beta 2 receptors. So in non-pregnant uterus, even though alpha 1 and beta 2 receptors both are present in the myometrium, but the dominant receptors are alpha 1, so that uterus can contract appropriately and enhances the probability of pregnancy, conception. Is that right? But when female becomes pregnant, you know, the female behavior before pregnancy and after pregnancy is different. Many of the wise men know that, because her behavior is appropriate for species perpetuation. Before pregnancies, female behavior is to get the right man, right? And after pregnancy is, once she is pregnant, her main concern is that pregnancy should go smoothly, uneventfully, and she should become a great mother. That is how they are designed by the nature, not only psychologically, but even at the uterus level, right? So what really happens, when they are not pregnant, alpha 1 receptors are the dominant receptors expressed on the myometrial smooth muscle. But when females become pregnant, hormones change, you know, estrogen progesterone level become high and they are no more cyclical. That signal goes and changes the genomic expression in myometrial cell. They switch off the alpha 1 receptor genes and activate the genes for beta 2 receptors. And pregnant female's uterus has more beta 2 receptors on myometrial cell than alpha 1 receptor. Am I clear? So that whenever she gets angry, it does not threaten the baby. Am I right? And this thing, why I explain so much, because it has some clinical relevance, my friend. The relevance is that when female is threatening to undergo premature labor. No, sometimes they have premature contraction and there is premature labor, right? For example, just on 25th week or 27th week, uterus start contracting. As a doctor, you would like to increase the contractions of uterus, or you want to relax the uterus and inhibit the contractions? Relax. And which receptor is there to relax the uterus? So which drug should be given? Drug which is beta 2 stimulant. Actually, there is a drug called Rytodrine, which is beta 2 receptor agonist. So females who threaten to, female uterus which threatens to start labor prematurely, one of the treatment is you give the female injection of Rytodrine. Rytodrine will go and stimulate, yes, beta 2 receptors on myometrial cells, and beta 2 mediated relaxation of myometrial cell will occur and premature contractions will stop. Am I clear? No problem up to this. So this was something about the uterus. About the secretions in vagina, I will not go into detail except that male erection and female secretions in vagina both are functionally and neurologically operated in the same way. When male get excited or stimulated sexually, they develop erection in their organ. When female get stimulated or excited sexually, they produce more secretions in their vagina. Both these mechanisms in male and female are stimulated by parasympathetic nervous system. They are stimulated by parasympathetic nervous system. But in male, ejaculation, and in female, orgasm is mainly mediated by sympathetic nervous system. And for sympathetic nervous system, we'll talk later in detail when we talk about the male urogenital system. So this was something about the uterus and vaginal secretions, and we have to talk about urinary bladder also, isn't it? That what about urinary bladder? Okay, here you have, I think I should remove this. It is disturbing your attention. Now, we will make a urinary bladder and we'll see what really happens to, yeah,
Delivery, it's alpha 1 then? Or is it?
it's beta 2. Delivery is operated by different mechanism. Females don't deliver the baby due to sympathetic activation. There were different mechanisms. Oxytocin is released. We'll discuss it in gynae of one day, right? Now we have to make a this is urinary bladder, right? And now, in urinary bladder, there are muscles here. These muscles of urinary bladder are called detrusor. Do you know that or not? Detrusor. And of course, there is, oh my God, there should be internal urethral sphincter also. Very, very important. Here is your internal urethral sphincter. Right? Now, this is your internal urethral sphincter, and this is your right. Now we have to talk about two things. Number one, when you are under stress and dog is after you or any big thing, what do you think? You want to pass urine or you want to retain urine? While you are running, it's not really very appropriate to pass the urine. So if you want to hold your urine, what do you think? Sphincter should, detrusor should contract or relax? Relax, of course. Detrusor should relax and sphincter should contract. It means detrusor muscle should be inhibited and sphincter muscle should be stimulated. Am I right? So when detrusor should be relaxed so that it does not push the urine forward. So there should be stimulatory receptors here or inhibitory? Inhibitory. Which inhibitory will be there? Yeah, there are beta 2. So actually detrusor have beta 2 adrenergic receptors. But during stressful circumstances, sphincter should be tight. So sphincter should be stimulated or inhibited? And if should be stimulated, then stimulatory receptor or inhibitory receptor? Stimulatory receptor. Which one should be there? Alpha 1. I don't know how you know it so well now. There are alpha 1 adrenergic receptor. Right? So it's very easy to understand that in the urinary bladder, detrusor muscle has beta 2 receptors and internal sphincter has alpha 1 receptor, so that when you are under stress, detrusor should relax and sphincter should contract. But of course, there are examples when someone under stress passes the urine out or she passes urine out, especially in children. That is a dysfunction of autonomic nervous system. Am I clear? Sometimes autonomic nervous system also gets confused, right? And detrusor contract and sphincter relax, an unfortunate situation develops. Right, so this was something about what? Urogenital system, about the male urogenital system. I told you ejaculation is? Yes? Sympathetic mediated, right? So during ejaculation, the smooth muscles in the prostate and vas deferens and other areas, because they have to ejaculate their semen, those smooth muscles should contract or relax? They should contract. If those muscles have to contract in the male genital system, then those smooth muscles should have stimulatory receptors or inhibitory receptors? Stimulatory receptor. Which stimulatory receptors should be there? Yes, alpha 1. There's no problem. So there's no fun in remembering that prostate has alpha 1 receptor, prostate has alpha 1 receptor. Logically, it should have alpha 1 adrenergic receptor because prostate smooth muscle, the vas deferens smooth muscle need to contract to expel the male, you can say semen. So there should be alpha 1 receptors over there. That is why men are usually not very happy with alpha 1 blocker drugs. There's no need to explain it. You understand why they're not happy with alpha 1 blocking drug? That's good. So Ronald understand that. And now the last thing which I should not forget, I told you that all the tissues to be stimulated have alpha 1 receptors except heart, which have beta 1, juxtaglomerular apparatus and adipocyte. I did not discuss juxtaglomerular apparatus. Let's talk about that. You must be knowing juxtaglomerular apparatus is present in kidney, isn't it? And in the kidney, one kidney has how many juxtaglomerular apparatus? Actually, with every nephron, there is one juxtaglomerular apparatus. So this is one nephron, right? And you must be knowing that this is your, what is this? Afferent arteriole, some smooth muscle from afferent arteriole, and some special cells from here, macula densa, with some other cells called Lacis cell. All of these together make this apparatus, which is called juxtaglomerular apparatus. Major function of juxtaglomerular apparatus is to release, what they release? Renin. And you must be knowing that renin will go into blood, convert angiotensinogen into angiotensin 1, which will pass through the pulmonary capillary and expose to pulmonary capillary endothelium, which will have enzyme, angiotensin converting enzyme, which will convert angiotensin 1 into angiotensin 2. And angiotensin 2 will lead to vasoconstriction, plus angiotensin 2 will lead to the release of aldosterone, which will lead to the retention of salt and water. So do you think when you are under stress, for example, dog is after you, you want to take your blood pressure up or down? Up. So it means angiotensin 2 should be more. It means eventually renin should be more. Secondly, under stress, you should retain salt and water, because under extreme stress in jungle life, there are chances you will get damage and you may bleed. So you start retaining salt and water to keep your volume protected in future, right? So aldosterone has to be more. So under stressful circumstances, renin should be released more, so that eventually vessels should constrict under the influence of angiotensin 2, and kidney retains salt and water under the influence of aldosterone. So renin juxtaglomerular apparatus should be inhibited or stimulated? Stimulated. So stimulatory receptors, inhibitory receptors. Which stimulatory receptors? Beta 1, not alpha 1. I told you all the tissues to be stimulated should have alpha 1 except heart, juxtaglomerular apparatus and adipocyte. So there are beta 1 adrenergic receptor present over there on juxtaglomerular apparatus. Again, it's important to remember why. Sometimes as antihypertensive drug, you may take propranolol or you may take atenolol. They block the beta 1 receptor here and reduce the renin output. And they have many other actions also. We'll talk that later when we study the drugs. Is there any question? No? Class dismiss. Thank you.